Hello everyone. This presentation will be covering oncology, which is a specialty in nursing. Oncology means the study and treatment of tumors. This branch of science deals with tumors and cancer. Onco, the first part of oncology, means bulk and mass. Nurses in this specialty provide care and help to patients dealing with cancerous tumors.
The roles that an oncology nurse provides are assessing a patient's physical and emotional status, past health history, health practices, and both the family's and the patient's knowledge of the disease and its treatment. The oncology nurse reviews the treatment plan with the oncologist, is aware of the expected outcomes and possible complications, and independently assesses the patient's general, physical, and emotional status. The nurse is also required to help educate the patient and their family on the disease and how they will be treating it. The nurse should be there for the family or patient if they have any questions or concerns. Sometimes the nurse is in charge of the coordination of care for the patient. This means that they set up the times for therapy, medication, hospital visits, checkups, etc. An oncology nurse is a mix of all roles that we have learned about in class. They are the patient's advocate and caregiver, while also being a manager of their hospital-related schedule. The personality of an oncology nurse is typically an ISFJ when using Carl Jung's theory to test personality. A nurse with this personality is reliable, stable, and down-to-earth, enjoys order and structure, dislikes conflict and confrontation, kind, warm-hearted, and considerate, practical-minded, very aware of others' feelings, and has a great memory for detail.
Radiation oncology is a specialty that involves the controlled use of radiation to treat cancer, either as a cure or to reduce pain and other symptoms. Radiation oncology nurses must work in collaboration with the radiation oncologists and technicians when caring for the patients. Their role has many sides, some of which include patient assessment, patient education, support and counseling, physical care, continuity of care, research, and administrative and leadership activities. Radiation oncology nurses are not only there to assess and treat, but also to support patients and make sure they are being heard. This is nothing new in regard to the role of nurses, but because radiation treatments can take such a great physical and emotional toll on the patients, support and advocacy are especially needed. Teaching is another big responsibility for radiation oncology nurses. Patients and their families may not know what to expect and are bound to have a lot of questions. Radiation oncology nurses have a good overall understanding of cancer medicine as well as radiation therapy and will be able to provide answers to many questions that come up before, during, and after the treatment process.
This interview was done with Jenny Peterson, who works in the Pediatric Oncology Department of Loma Linda Hospital. The first question that I asked her was, "What made you decide to work in the Pediatric Oncology Department?" To which she replied with, "It all started when I volunteered one summer at the hospital. I was assigned to play with the kids in the oncology department. I loved that the patients just wanted to be kids and were so resilient, even though they were going through so much." The next question I asked was, "What does a typical day in the Pediatric Oncology Department look like?" Jenny said that a typical day starts by getting a report from the previous shift. You plan your day out, check your patient's vitals and assessments. At 0900, it is breakfast and medication time. You also make rounds with the multidisciplinary team. Oftentimes, the nurse will give chemotherapy talk with the parents about the health care plan of action and teach throughout the shift. If your patient is school age, they will go to school. You plan and coordinate with other services to get tests done, PT, OT, SP treatments, and in between, vitals and scheduled medications. Then your day is complete. Some days it goes by so fast because you get to play with the kids. Those are the days that we all love. The third question I asked was, "What characteristics/personality traits would you say are most important to be able to work in this department?" The answer I received was, "This is a tough one. You have really got to love the kids. You have to be able to hold it together and work in a crisis. It happens often, so teamwork is a must. Pulling together to help your patient and your coworkers is very important." The fourth and final question that I asked was, "This department is notoriously hard to work in, and we hear a lot about the sadness within it, but what are some pros of working in this unit?" The answer I received was, "Everyone always says, 'Oh, how sad,' But when you walk into our unit, you will see happy nurses laughing with patients and fellow healthcare members. We are all hoping for the best in our patients. One perk is getting to build rapport with your patients and their families. You make a connection with them. When it is sad, we all pull together and support each other. We are lucky that treatments have improved and our patients are doing better and surviving their cancers.
Oncologist is someone, specifically a physician, who specializes in the diagnosis, treatment, and/or prevention in blood diseases and cancers. As mentioned before in the presentation, oncology is the study of cancer, while hematology is the study of blood.
When working in the oncology department, instead of saving lives, you may have to try and make the little life left for the terminally ill as comfortable as possible. This can cause burnout in nurses. Nurses get emotionally attached to the cancer patients that they are looking after, and when these patients die, they have to deal with the loss of a friend. Over time, you experience a lot of losses, which should cause emotional problems in your life. In order to prevent compassion fatigue, you should talk to a professional if you feel emotionally stressed or tired. Many organizations also provide retreats for nurses on the edge of burnout that might prove helpful as well.
Oncology patients are usually chronically or critically ill. Although working in this field can be emotionally difficult, there are many aspects to it that make it all worth it. Being there for patients has been described as one of the most rewarding parts of being an oncology nurse. Working with patients who are dealing with cancer means that you get to help make a difficult process a little bit easier. The patients are often there for the long run, and during this time, a special bond between nurse and patient can be formed. By providing for patients physically, mentally, and emotionally, oncology nurses can make a difference in every life they care for.